So I'm delighted to be back again. It sounds like the conference is going very well. And right now, I'd like to award the Pike Prize. It's an honor and pleasure to do so, and in particular to do so with Dr. Casscells. The Pike Award is named for one of the law school's distinguished and accomplished alumni. As I mentioned earlier today, the conference is named for him and Neil Pike. Mr. Pike was blind. He lost his eyesight at the age of 7. He nevertheless persevered to overcome the challenges that this handicap presented, and he attended BU Law and graduated in 1937. He was an excellent lawyer, a lifelong advocate for individuals with disabilities, and a generous philanthropist. In 1972, he established a scholarship fund as a way of showing his gratitude to the School of Law for providing him with, in his own words, a profession and a career which made it possible to overcome the handicap of total blindness, to be self-supporting, to live a normal life, and to take a place in society. The Pike Prize, which was also endowed by Mr. Pike, is presented annually to an individual who, despite a physical or mental disability, has achieved notable success, or to an able-bodied person or organization that has been of great service to people with disabilities. Past recipients of the Pike Prize include Professor J. Katz, an accomplished scholar and humanitarian, Max Cleland, a triple amputee who went on to become a distinguished U.S. Senator and Administrator of Veterans Affairs, Lowell Weicker, Jr., former U.S. Senator and Chair of the Senate Subcommittee on the Handicapped, Jerry Lewis, National Chair of the Muscular Dystrophy Association, the Honorable George W. Greer, the judge in the 6th Judicial Circuit of the state of Florida who presided over the Terry Schiavo case, and the Boston Center for Independent Living, a frontline civil rights organization led by people with disabilities to provide advocacy, support, and services to people with disabilities. This year, we're pleased to award the N. Neil Pike Prize to Dr. S. Ward Casscells, former U.S. Assistant Secretary of Defense and Iraq War veteran. As U.S. Assistant Secretary of Defense for Health Affairs, he worked to integrate the Department of Defense and Veterans Affairs, Health Services, and disability determination processes. This change improved the treatment of soldiers with traumatic brain injury and post-traumatic stress disorder, as well as the rehabilitation and recovery services for all injured soldiers. Government Executive Magazine said of him, "Many defense leaders say they pay attention to the troops and don't. Casscells does." He is credited with turning around a struggling $45 billion health system with 137,000 employees and 10 million patients in 900 clinics and hospitals in 100 countries. During his tenure, Dr. Casscells also expanded our military's efforts in disaster relief, both here and abroad. For example, in places hit by earthquakes like Peru and Pakistan, by tsunamis, as in Indonesia, and by war, as in Iraq and Afghanistan, or by the threat of war, as in Yemen. Under his leadership, the Department of Defense Health Affairs also played a role in global efforts to respond to the flu pandemic. He has received the DoD's highest civilian award, the Distinguished Public Service Medal. He was also honored with the Surgeon General's Medallion from the Department of Health and Human Services, the Army's Distinguished Public Service Medal, and the Order of Military Medical Merit. A colonel in the Army Reserve, Dr. Casscells served in Iraq in 2006 and earned the Joint Commendation Medal and honorary membership in the Iraqi Medical Regiment. Dr. Casscells and BU's Professor George Annis have a long history of discussing difficult issues together. At Professor Annis's prodding, Dr. Casscells worked with DoD Health Affairs members to rethink the procedures for force-feeding detainees at Guantanamo Bay. The two men have also tackled the issue of how to keep physicians from performing lethal executions of prisoners condemned to death. As with almost every issue they have discussed, they have disagreed on some points. And if you know George, that's not surprising. But through 3 decades of arm wrestling over hard issues, they have built a relationship of trust that has allowed them to collaborate effectively on critical issues of the day. Currently, Dr. Casscells is the John Edward Tyson Distinguished Professor in Cardiology and Vice President for External Affairs and Public Policy at the University of Texas Health Science Center at Houston. He is also a senior scholar at the Texas Heart Institute. I have no doubt that our alum N. Neil Pike would, as we are, be extremely proud to see Dr. Casscells receive this award, and I'm very happy to present him with the N. Neil Pike Prize. Congratulations, really. Thank you so much. And
could probably take it on the floor. Okay. Thank you, Dean O'Rourke. Really honored to be here, and I enjoyed hearing about Neil Pike last night and his challenges that he'd overcome. And Professor Annis had some wonderful stories about him. My experience has not been nearly as challenging, although I do remember 9.5 years ago diagnosing my own prostate cancer, which several people had missed, and good doctors, and reading a dreadful-looking X-ray that looked like a Dalmatian, and knowing I just had a couple of years, and I had a wonderful remission. But after that, by that time, I had no practice left. My laboratory had been closed by a flood. It devastated everything. It took all our office records and our graduate students' data and the mice and the computers, and we were destroyed. And I was struggling with cancer. I had very few patients. I had to give up my house. We moved into a house down the street. My 3-year-old daughter asked why there were holes in the ceiling. We told her we were camping. But God gave me a remission, and I wondered what to do with the rest of my days. So I joined the Army. My father had been an Army surgeon under Patton. And one day my son, who was then 7, 2 sons, but the younger was 7, and he was looking at my father's uniform that he'd found in the closet. And I saw him looking at it, and he looked up at me with a look of deep disappointment. He didn't say a word, and I said, "Off to school with you." And I walked past the bedroom, and I said, "Roxanne, I'm going down to join the Army Reserve." And she said, "Sure you are." And they wouldn't take me, of course, but after a while they took me. I had a waiver. Sergeant Martinez said, "Sir, how old are you?" I said, "I'm 52. He said, "Well, maybe you'd get a waiver if, like, you're a doctor or something." "Well, I am a doctor." "Your health had better be good." "Well, I have chronic cancer." "Oh, no." Anyway, finally got into the Army, and I struggled through basic training, but I quickly went to Iraq and Kuwait and Thailand, Afghanistan, several deployments. And I struggled to keep up with the young people. I wasn't blind, but I was getting a little senile, and it was hard to keep up. I know this award is not given to me, but to the efforts of the Defense Department, which has woken up to the problems of PTSD and psychological health, although the great veterans advocates in the room, I think, would agree with Professor White and Paul Sullivan that more could be done, and Professor Mariner. I want to start, let me just say to Professor Annis, thank you for being behind this somehow. He's so respected for his scholarship and his advocacy at the same time in equal measures. And he's been a worthy guy to wrestle with at the Pentagon, a champion for ethical causes and questioning many things we did. And it was because we had a shared background in academia that, as the dean says, we were able to actually wrestle them out. And I heard a view from him on several matters. Of course, it's never hard understanding where he's coming from. That were views I wasn't hearing in the Pentagon, and it enabled me to make some improvements, although even I wasn't as successful as Professor Annis would have liked. But that's a great role, not just to write books, but to make a difference, although he's a great writer of books. He just doesn't have a sense of humor. That's the only problem, that guy. Professor White, thanks for not giving up on Gulf War illness. I think you'll have a champion soon in Dr. John Woodson, who will be the Assistant Secretary of Defense for Health Affairs. You know, if you live long enough, you get asked to lead a few things, and you get some undeserved credit for things. And at the Defense Department, I supported a wonderful person, Dina Cohen, who supplied electronic assists to the disabled, both in the Defense Department and now throughout the country. She's won many, many awards. So when Professor Annis called me, I first thought it was for supporting Dina Cohen. Supporting Dina Cohen is like saying the sun will rise in the morning. I mean, sort of, she's so successful. But anyway, the award is more for PTSD. I understand that now. Depression, psychological health. And I think the speaker in the front row and Professor Mariner and Dr. White agreed, and several of the others. This body-mind dualism is an interesting psychological problem, but an intellectual problem. But depression becomes a real physical problem, and vice versa. Our soldiers with injuries, nagging back injuries, just like an occupational worker, can develop depression. And if their symptoms are dismissed early on, the depression worsens, because then their whole integrity is being questioned. And the integrity of a soldier is terribly important. If your word is doubted, there are very, very few malingerers in the military. There are some. There have been in every war. There's so few in today's Army that it's vanishingly small, but there's still a culture to watch out for malingerers, because they're just with every deployment, there are a few people who don't want to go. They have problems at home, whatnot. And then there are a few people who come back and don't know what they're going to do, and they need to get that disability, 30% disabled, so they can become a TRICARE patient. If not, they're in the VA system, and they got to fight through the VA. And the VA is a bureaucracy you got to fight through. Although it can deliver very good care if you have illnesses that they can identify. If you're just left with depression, it's a killer. Depression causes obesity, heart disease, diabetes, suicides, accidents. It's a terrible problem that we haven't solved. So we in the Defense Department are putting a lot of money into it. And I'll get back to that in 1 second. But first, let me also just thank BU, Schools of Law and Health, for being among the few who take an interest in our veterans. There are many things that law schools and schools of public health can rightly take an interest in, but very few take an interest in the 0.5% of Americans who wear the uniform and defend the rest of us. Within that group of uniformed service members, about 10% of the war fighters, not the desk workers, but the war fighters, about 10% come back with PTSD. A whole lot more have post-traumatic stress. I had pre-traumatic stress. People sometimes wonder what that was. I guess it was scared out of my mind. I'd been to the training. In the training, they tell you how to survive, how to have some small chance of surviving kidnapping. They were kidnapping doctors like crazy in Iraq when I went there in the dark days of 2006. I came back from my pre-deployment training very, very worried. I had 3 young kids. And I knew that I probably couldn't survive a kidnapping. They lock you in a box, and then that's the good thing. Then they take you out and torture you, and you hope you have a suicide pill. And I woke up one night and I said to Roxanne, the room is really hot, and I am really short of breath. I may have a blood clot in my leg, a pulmonary embolus. She goes, honey, you're hyperventilating. Why are you doing this? You never hyperventilate. I said, I don't know. I said, I'm not hyperventilating. I have a blood clot in my lung, a heart attack. I'm 50, by the time I was 54 years old. She said, you're stressed. You're having a panic reaction. I said, okay, maybe I'm having a panic reaction for the first time in my life. I said, but look, you know, we got 3 young kids. I could get out of this maybe. Maybe I don't have to go to Iraq. Sweetheart, the invitations to your goodbye party are already in the mail. You're going to Iraq. Well, I wasn't going to give up. The next morning I said, look, we can cancel this party. She said, you're not going to embarrass your sons and your daughter. So that kind of tough love is, I hated it. But I think in retrospect, it was good. It was like having a good first sergeant. I didn't have a first sergeant, but Paul Sullivan and the others know what a good first sergeant means, tough love. Yeah. So I went to Iraq, and I survived it. I actually had a enlightening time, and but I came back with a deep sense of how stressful it was, because we saw a lot of people who had been decapitated and tortured, and I worked in the hospital where we had a lot of injured coalition forces and Iraqis, and we took care of a lot of wounded insurgents too, and patched them up just as well as any American soldier. And we gave them our blood, and insurgents came in, they got blood donated by American soldiers. So it's a stressful environment, and about 5% of our kids come back with long-term PTSD, and it becomes a problem that interferes with their work and their family life. Often before the service member knows it, because they don't want to have PTSD. They'd rather have a chemical exposure. They'd rather have the AK-47 round in their thigh. Who wants to be told they have depression or PTSD? You're not much use to your unit. You're probably not going to get promoted. You may lose your weapons clearance, your security clearance, and you may not be fully trusted by your battle buddies. So no one wants to have it. It's miserable. But believe me, the military leadership now is working hard to persuade every soldier, sailor, airman, Marine that it takes strength to ask for help, and that no battle buddy left behind means not just leaving our captured or are wounded, but those who have psychological issues. And if you see your buddy with a long face, picking at his food, reading and rereading and crumpling up a letter, that's the guy you got to go put your arm around and say, you're going to see the psychologist, or you're going to see the chaplain, or I'm going to take you there. And we're trying to get that message across. Now, to understand it, though, to do the research that Professor White talks about takes a lot of money. And I asked for billions, and I got a lot of pushback. At a decisive meeting on this, one of the senior leaders of the Pentagon said, Dr. Casscells, what you're asking would cost us a whole carrier group. It would cost us a carrier group and a wing squadron. You are not the tip of the spear. Healthcare is not the tip of the spear. I was new at the Pentagon. I was just a little Army colonel back from Iraq, and these guys were seasoned Pentagon administrators. But I somehow got the inspiration to say, you are right, sir. Healthcare is not the tip of the spear. Healthcare supports the muscle behind the spear, the vision, the brains, and the heart. That's all healthcare is. Let's ask Dr. Gates. It's a very tense meeting, but we got every penny. Bob Gates, the Secretary of Defense, deeply supports research into healthcare and healthcare itself, including psychological care, and so does Admiral Mullen. And we spent billions, and we've made some progress, and we have some idea now of what triggers PTSD. We have better ideas about depression. We are still struggling with a rising suicide rate, and in developing ways to build resilience in our new recruits, to better detect and to treat. I've learned one thing, though. 150 pounds of most of our psychiatric medicines are not nearly as helpful as 150 pounds of a good psychologist, psychiatrist, social worker, or chaplain. The only things that can beat that are a wise and loving family and a wise and caring boss. But even when you return and you have those, as I did, I came back to a wonderful family and a wonderful boss, but both of them, all of them, had learned to do without me. So you have to win your way back into your family. Make no mistake, the best way to worsen a case of PTSD, in the case of a reservist returning to his or her old job, or someone leaving the service to find a civilian job, entering the civilian world, retiring from the service, or just departing the service, separating. The best way to worsen that is to go to an employer who's thinking in the back of his or her mind, gosh, aren't all these people a little bit unstrung, a little unstable, dangerous? Some of them aren't very good family people. They don't say that, but the soldier or sailor or airman can see this. The Marine can see this. They're nervous about a veteran. That's a dreadful mistake. The statistics show that our veterans come back, in the main, stronger for the stress they've been through, wiser, gentler, smarter, well aware that war is no glorious picnic. They come back ready to be members of a team, and they come back understanding about leadership. And to not employ them and to have this 15% veterans unemployment rate that we have today is a disgrace. And it's because of, I think, well-meaning media that focus on a small number of, misbehaving veterans, a very small number. Indeed, when a congressman asked the Lockheed Martin chairman, Norman Augustine, one of my heroes, why he hired so many former soldiers and sailors, airmen, Marines, other veterans, he implying that Lockheed Martin was preferentially hiring veterans, for Christ's sake. What is this, a revolving door? It was a very antagonistic question. And Norman Augustine said, at Lockheed Martin, we hire the best people we can. If they happen to have served their country, we don't hold that against them. I say this because you, as an advocacy group, many of you here are advocates, get used to demanding that the government be held accountable for everything. This was particularly true during the Bush years. But we should also be certain in the Obama years that the government fulfills its promises, of course, hold them accountable. But it's just as important that we press the private sector to hire our veterans. Now, we'll soon hear from other veterans, Anthony Hardy and Paul Sullivan, and Professors Grodin, Annis, and Glantz, followed by a discussion. I want to thank you again for this award. I will continue to engage on these issues and try to deserve it so that next year's winner won't look at the list of prior awardees and say, who? Or worse, him? Thank you very much.